Thank you for dropping by at Equity Communities of Practice, the convening place for cross-sector collaboration, community advocacy, and personal development, where development and growth are key to achieving sustainable and effective change. Our mission is to leverage insights gained through ongoing community building to promote health equity across all sectors, including finance, education, healthcare, public health, environmental justice, corporate social responsibility, and more. For more information, visit our website at www.equitycommunitiesofpractice.com. Together, we can make a difference. And now your host, Executive Director, Dr. Harry Pettaway, aka Dr. Harry the Equity Coach.
Good afternoon. Good afternoon. I hope everybody is having a great afternoon. My name is Dr. Harry, the Equity Coach, Executive Director of Equity Communities of Practice. If you are tired of the same old news in your feed, if you feel like you're preaching to the choir, you feel like you're in silos, stuck, be it work or life, come on over to Equity Communities of Practice and I will help you break your personal algorithms so that you can make the changes that you want to make. So, as always, hey, I appreciate whomever is watching. If you wouldn't mind, if you could tag someone, if you think that this content is interesting, if you're new, please follow me on LinkedIn. I'll leave the QR code there. Talking about how I'm arriving today. It's an interesting day for me. Interesting is an understatement. I'm arriving a little heavy-hearted. It will be the third anniversary of my mother's passing today. I tried to do a lot of things to set up for this week. Tried to do some things that I thought would be fun. You know, some of those, hey, let's make a difference. Let's do something profound. It just didn't work out. But I miss my mom. If my brother and sister are watching, Debbie and George, I love you both. Almost didn't make this video. I was working on it and I really couldn't get it together. And one of my friends, Rika, called and put me in a little bit better mood. So I think we can actually work through this. So why are we here? This is episode 4 of Happy Social Determinants Month here in Michigan. If you're in another state and you celebrate Social Determinants Month, let me know in the chat. If you're here just for the tech, let me know in the chat. And you don't have to be from Michigan to enjoy this. I think this is something that all of us can really get into. Again, social determinants, economics, education, healthcare, health services, built environment, and the social context. And today's Social Determinants Month is the workforce. The workforce is a powerful driver of health outcomes, shaping education systems, economic stability, and access to healthcare and health services. Its impact spans all levels of the socio-ecological model, influencing individuals, institutions, and policies alike. Recognizing the workforce as a social determinant of health underscores its role in advancing equity, improving health outcomes, and fostering community well-being. However, even a few, and I stress that, just a few poorly performing individuals within the workforce can undermine progress, creating inefficiencies, eroding trust, exacerbating disparities in education, healthcare, and public health systems, and can also lead to severe consequences, including preventable death and illness. You know, as I think about the workforce, I can't help but talk about my mom and her experiences in the healthcare system. It's one of the things that has driven me my entire career, and especially so, the last year of her life, because I know enough about the administrative and clinical operations be aware of some of the things that actually should be done or should be done. I'm not an expert in that, in all of it, but I know enough to be dangerous. When I think about my mom and, everything that happened, the last year of her life, we dealt with two different health systems. And you could absolutely tell there were people that love to help others. I'm in this to make a difference. I want to take care of someone the way that I want someone to take care of me. And then there were obviously people that just were there for the paycheck, which goes back to, if you go back and look at the quote that I had in the very beginning, it relates to that. But when I think about the workforce, it's related to my mom. Sometimes people, whenever they hear workforce, especially as it relates to health and healthcare, they automatically think it's just nurses, and nurses were a part of her care. Absolutely. There was one environmental services worker, man, she would come in there every day with a smile. Now, my mother did not know she wasn't a nurse, right? She had no idea. And I talked to this wonderful woman one day, and she told me, she goes, "These are my patients." And that one hit me hard, right? I mean, you hear doctors talking about, "These are my patients," nurses, "These are my patients." And then, the medical assistants, obviously, but to hear an environmental services worker telling me that she does what she can because she knows some of these people don't have anyone to visit them, and that she's going to make sure that when she leaves, that they have a great day. At least she made a positive impact. The workforce is complex, right? So, my mom ended up in a skilled nursing facility for a little bit, and it was an interesting place because, we had been there twice. The first round, I would get these calls from my mom in the middle of the night. Started listening to them, and there's this one worker that was just so mean. It was a nurse. She was so mean, and I had a chance to meet her one day, and she would purposely come in and she'd flip her tag around, so you couldn't see who she was. And at the time it was COVID, right? So she didn't want to wear a mask, and I told on her. She hated me for that because, you're not gonna get my mom sick. But on the flip side of that, she had an incredible staff was there as well. I mean, she had some other nurses that were super awesome. The medical assistants there, I don't think that they get enough credit for the work that they do, because they really do bear the brunt of all the caregiving in those facilities. But she had this really cool nutritionist. The nutritionist loved my mom. She loved my mom. And she went out of her way to help. My mom had GERD, all kinds of things, so she couldn't have spicy food. She couldn't have salt and stuff like that. And no matter what the nutritionist did, the staff could not get her diet right. So, there were times that we were bringing my mom food and things like that. But I don't want to make it all negative. She had some great doctors too. I would talk to the doctors and about the medications that my mom was taking. The point of all this really is to say, workforce matters. And when I think about, my mother, my mom was also in the workforce. Her and my father were both teachers, right? And you think about, well, how do teachers affect health? And so we've already talked about that. Education plays a huge factor in that, but my mom used to go beyond that. I remember my mom bringing people food that didn't have it. Her students didn't have food. Students that tried to commit suicide, going to visit them at the hospital and things like that. And, it all matters. I don't think we think about that. I don't think that we think about the workforce, the public health workforce, people like Nina Sassy here in Michigan, that have a team of people put together that are trying to bring collaboration amongst Michiganders. I love saying Michiganders. I don't think we give them enough credit, right? I don't think we understand how we are all connected. Workers, impact that workers make in our everyday lives, whether it be healthcare, education, whatever it is. So the next time you see some workers, when you see the workforce, appreciate them, appreciate that you are actually a part of the workforce, which makes you a social determinant of health. With that, again, I'm going to keep this short, but I miss my mom. And I know a lot of people miss theirs too. So you guys have a good night.